See if I'm able to share my screen even. Okay, fine. We're good.
Yeah, the slide sharing is good.
Perfect. I will.
You're able to run through the slides just as a trial?
It's time.
Oh, good, good. A very good evening to all of you. Hope that you're all doing well and blessed. It is an honor and a pleasure to have you here today for this webinar. Thank you so much for creating time for today's webinar that is about curating a culture of mental health support in the workplace. Welcome on board this amazing conversation. It is my prayer that you're going to have an opportunity to learn and be able to take something home that is going to nurture you to be able to support a beautiful and amazing and a careful mindset at your workplace and be able to thrive. Now, I'd like to know just before we begin, where are you signing in from? We know that we have doctors across the country. So just in the chat box, I'd like to know, where are you signing in from? Which town are you in? Personally, I'm coming to you from Thika. Our very, very beautiful presenter, Dr. Florence. Where are you coming in from? You can all just type in the chat box as we continue to wait for other people to come into the conversation. Sharon Aura, Nairobi. Nairobi is well represented. And do remember to share the link with your friends, with your colleagues. Remember that this is a very important conversation, not just for doctors, but also for other cadres of professionals. I can see our very able president, Dr. Simon Kikondo, is signing in from Muranga. Karibu sana Daktari. Timothy Ngetich, Meru. Buoga Simon, Kilifi County, Bamba Sub-County. Wow. Well represented in the coastal region. Kisii Titus, Frederick Eldoret, Daido. Wow, an interesting name. Nairobi, Eric Masharia Muranga, Donald Kakamega, Eunice Kisii again, Edna Joy Kwale, Seth Kinda Kitale, Samuel Wanjala Thika, Josephine Wanza Kiambu, Hamdi Suleiman Kilifi, Martin Abuton Nakuru. Yes, let's continue telling our friends to come on board this amazing conversation. I know that Dr. Florence has really put together an amazing presentation for us in order to be able to equip us with the right knowledge that's going to give us power to be able to curate a culture of mental health support in our workplaces. Wesley, you are signing in from Nairobi. Nairobi is well represented. Mother Awiti Kajiado, lovely, lovely. I'll allow us to just check in with where we're coming in from till around 5 minutes past 7. Priscilla Makao Kitiri, karibu sana. Till 5 minutes past 7. After that, I will be able to welcome the speaker on board so that we're able to have adequate time for this conversation. Thank you so much, guys. Just as it's coming in from Diani, lovely place to be. Anne Mwangi from Kiambu. Peter Koech from Eldoret. Daniel Lane from Kajiado. Amazing, amazing, amazing. Yes, do remember that this is the first of a series of conversations that we're going to be having from the KMA Physician Wellbeing Committee. These are conversations around mental health and wellness around the workplace and even in different areas. But it's going to be happening weekly. That is from 7 p.m. to 8:30 p.m. We did not have one yesterday because we had a concurrent webinar that was happening from the Young Doctors Network team. So, ladies and gentlemen, my fellow doctors, do mark the calendar dates that are blocking out every single Tuesday from 7 to 8:30 p.m. This is an important conversation that you need to be part of in a holistic manner each and every week. Another thing to note is that the webinar is being recorded and you shall all be issued with CPD points for attending this particular webinar. Also, just to reiterate on the fact that we're having this as a series of several conversations, they will be happening weekly. That is from October, November, all the way to mid-December. Do note these key and important points. I hope that you're ready for today's mind-riveting conversation and that your hearts are ready to learn, and not just to learn, but to be equipped with the right information. I'd like to bring our speaker on board, Dr. Florence Chabuga, a very beautiful lady, I must say. But before I bring her on board and just to let her have the floor, I'd like to introduce her just by reading her bio. Dr. Florence Chaguga is a psychiatrist working at the Moi Teaching and Referral Hospital. She is the acting director, mental health, and head of Department of Alcohol and Drug Abuse Rehabilitation Services at the Moi Teaching and Referral Hospital. She is the chair of the Employee Assistance Program at MTRH and a member of the KME Physician Wellness Committee. A beautiful lady with many hats. Let's all give her a round of applause as she comes to take the floor to be able to bring to us this important conversation. Karibu sana, Dr. Florence Chaguga. The floor is yours.
Thank you so much, Joanne, and good evening, colleagues, and thank you for tuning into today's webinar. And we'll be talking about how to create a culture, that supports mental wellness in the workplace. And we'll be focusing on mental wellness for healthcare workers and specifically for doctors. Just a slight hitch with scrolling. Okay. All right, so we'll start by looking at how common mental health problems are among healthcare workers, and then why it's important to think about them and to put in place strategies to address them. Then we'll look at the things that we can do to address mental health problems. And because of the recent conversations we've had on the different social media platforms as doctors, we'll also have a short discussion about bullying. Okay. So the rates of mental health conditions are very high among healthcare workers. Burnout is just one of them. It's not really a mental disorder, but it's let me say, a mental health condition. And burnout really means emotional exhaustion, physical exhaustion, feeling like you are not able to continue experiencing positive emotions and to be compassionate towards the patients that we take care of. So that's what burnout is. And in meta-analysis, they pulled data across many different studies in Africa, and they found that the rates of burnout were 66% among healthcare workers, that's sub-Saharan Africa, and also a study done in Kenya among nurses, doctors, clinical officers in a reproductive health setting, found that 85% of providers said they felt that they were moderately stressed, about 10% high stress, and also burnout, high burnout was about 20%. So these things are really with us within the healthcare setting. Okay. Sorry. And many healthcare workers are struggling with, diagnosable mental health conditions. And during COVID, a number of studies were done to look at the mental health of healthcare workers. It's interesting that COVID time was the time when we really focused on healthcare worker burnout. Yet for sure, it was happening before, and even after COVID, it continues to happen. But during that time, we did a number of studies, and one done by our colleague there showed that 32% of healthcare workers met criteria for depression, 36% had generalized anxiety, and a very high percentage there had probable post-traumatic stress disorder. Okay. And then again, other colleagues also did another study during COVID, and those are the rates that they found: 53% for depression, about 41% for insomnia, all the way to 45% for for burnout. So this just goes to show how common these mental health challenges are among healthcare workers in Kenya. All right. And it's also interesting what we find when we try to look at the factors associated with mental health symptoms among healthcare workers. We find that females and doctors are at higher risk of mental health symptoms. And those are some of the mental disorders that have been assessed. Of course, if you were to look at things like substance, then males would be at higher risk. And then also down there by our colleague, we found that also females were at higher risk of those symptoms of depression and anxiety, younger healthcare workers, those who are not married, and then those also who had less experience. So understanding some of these risk factors helps us to know who we should focus some of these mental health preventive interventions on. For substance use among healthcare workers in Kenya, there was a study done again across multiple health facilities, I think around Nairobi and its environs, and they found that 35% of healthcare workers had ever used alcohol, which is very similar to what we see in the general population. 23.5% had smoked tobacco. This is much, much higher than what we see for the general public in Kenya, which is about 9% or thereabouts. And then 3 to 10% had used all these other substances. So again, it is common among healthcare workers. And at MTRH, our colleague did a study during her postgraduate, and she found that the lifetime use of alcohol was 42%. This is higher than what we see in the general public in Kenya, which is about 30%. And then tobacco and cannabis are as you can see. So the previously held beliefs that, healthcare workers are the ones who understand the things that they need to do to stay healthy, and they're likely to engage in these practices that make sure that they are healthy is not necessarily true, and that healthcare workers are just a reflection of, their practices are a reflection of what happens within the general population. Thank you. Some of the factors associated with substance use among healthcare workers, now we can see being male. And this is a very common pattern we see for mental health disorders, with depression and anxiety more common among the females, and then substance use more common among the males. We also found that having a colleague who is using substances, puts you at increased risk when substances are available in the workplace, and many times they are. Being single or unmarried, just as we had seen with the mental health conditions, being a doctor or consultant versus another cadre, okay, and about 11 to 20 years of experience. So why should we pay attention? Why not just let it slide? Why should it bother us? Why should it be something that we talk about and prioritize? And it's for many reasons. So for the individual, for me who is suffering a mental health condition, it places me at risk of multiple chronic diseases, including cardiovascular diseases, diabetes, and also there's some data on cancer that is emerging, but also other conditions like migraine, like fibromyalgia, inflammatory bowel disease, and so on and so forth. And then also poor mental health is really linked to reduced productivity, reduced quality of life, and even mortality. Okay. So it concerns us because it can affect our health, and it can affect how long we live on this earth and how well we are able to enjoy life and to achieve our goals. Okay. And for alcohol and drug use, Also, the consequences are similar, maybe even worse. So alcohol is a risk factor for many diseases. They say about 30. I forget, but you can look at the Global Alcohol Health Report, the latest one for 2024, and they show how alcohol contributes wholly to some conditions like alcohol use disorder, but also partly to various chronic diseases, cardiovascular, digestive, cancers, injuries, road traffic accidents, all of that data is there. And then also substance use contributes to suicidality. We've seen that in the context of alcohol, in the context of cannabis. Psychosis, again, very common with cannabis, but we also see it with alcohol. Anxiety, very, very common with cannabis. Depression, again, common with alcohol and cannabis. So, these substances increase the risk of a host of um, many disorders. I've had young people sometimes say that cannabis is not harmful, it's not addictive, it helps them to be creative. But then I say, so fine, it makes you creative, but on the flip side, it can increase the risk of you um, having schizophrenia in the future, for example, or it can affect your productivity in the future and your social functioning. So it's just weighing the pros and the cons of some of these practices. Also increased risk of interpersonal violence, including intimate partner violence. Again, like mental health conditions, reduced productivity, social dysfunction, and reduced quality of life, and just an overall inability to be productive, especially when we get to the severer ends of substance use disorders. Thank you. So we've looked at why we should pay attention. It's because it can affect our health and affect our functioning in the society. But within institutions, why should my employer, as Moi Teaching and Referral Hospital, be concerned about my mental wellness? What is in it for them? What happens to Moi Teaching and Referral Hospital if I'm not, mentally well? It's because also employees are a critical resource for their, different organizations. A lot of organizations, meet their mandate using human resources. So what happens if that critical resource is not functioning well? It means that the mandate of the institution cannot be achieved, the goals of the institution cannot be achieved. And in the case of a healthcare setting, it means we are not taking care of the health of others. The mandate of a hospital is really to take care of the health of the community. Again, and the public is really also an important resource for a country. So we can see how it can spiral from poor mental health of a healthcare worker. It affects the institution, it affects the community as well. But also having an impaired doctor or a healthcare worker in the workplace can pose very serious safety risks. So it can be injury to the person themselves, maybe when intoxicated or when acutely unwell, to things that can also affect patients, like giving excessive medication or not being able to attend to a patient as is supposed to be. So for all these reasons, the employer or the organization or the healthcare facility should also be interested in the mental wellness um, of the healthcare workers and really of employees that work in that institution. Okay. So even though we know that we need to pay attention to mental health issues, why are we not having mechanisms for addressing mental health issues in many institutions? So there are a couple of factors at system level, but also we look at certain individual factors. So mental health, if you look at it historically, it has lagged behind other aspects of the medical setting, other specialties. If you think about pediatrics or surgery and so on and so forth, those ones have been practiced practiced for, hundreds of years and they're well established. But if you look at mental health, even the first antipsychotic chlorpromazine was, I think, in the early 60s. So it's still a very young uh, specialty, not very well understood in terms of what causes it. We are trying to understand it more and more now, but still, even in some places, not accepted as a medical condition still. So because of that, you find that there are no mechanisms to support the mental health of staff in institutions, and also overall in communities, you'll find that in primary healthcare facilities, actually sometimes even all the way to level 5, you really don't quite have mental health services. So those constitute a major barrier to accessing treatment, and then still a lot of stigma and discrimination are just emanating from people not understanding so well what constitutes a mental disorder and how does it come about, how should it be taken care of. There are discussions about whether it's voluntary, whether it's involuntary, and those kinds of things. So we still have a lot of stigma, and mental health services are generally not well um, established, even though things have improved in Kenya, at least I would say the past decade or so. And then also unique to doctors, it's also our own personal factors, and I would even say the extension healthcare workers. So we have a certain way of thinking and behaving that makes it hard to accept vulnerability, whether it's because of the training that we undergo or the work that we do that entails rescuing other people. We tend to inevitably develop a personality that does not accept that we are having challenges and we want to be well all the time. We are not ready to see a doctor when we are unwell, not even with mental health conditions, even with other general health conditions. What we see is that it's a bit not easy for doctors and healthcare workers to seek care. And I think it's worse for mental health care, or even in cases where there's alcohol and drug abuse. It's really until really the tail end when there's, severe dependence with a lot of comorbidities, then someone actually shows up, maybe when there's not too much that can be done. And then also, this is what I, noticed, that sometimes as doctors or healthcare workers, you may have unrealistic expectations about life and health. Uh, that we cannot fall sick. Florence, as head of alcohol and drug abuse, cannot have a drug abuse problem. It's possible for me to have a drug abuse issue, and so on and so forth. So some of these individual factors make it that we don't easily accept to seek mental health care. At Moi Teaching and Referral Hospital, we do have a staff clinic, a staff mental health clinic that we run weekly, but still the number of people voluntarily coming for help is still really, really low, unless now there's coercion when it's really affecting work productivity, or it's really affecting health, then people have to sort of be coerced to come. So the way people voluntarily seek care for, physical conditions is not the way they do for mental health conditions. So fortunately, there are things that can be done to support the mental wellness of healthcare workers. It's not we have challenges, that I've talked about in access to care, but, there are things that we can do with the available resources in our different institutions. And it needs effort from myself as a healthcare worker, and also the institution. So it's not that the institution must do everything to support the mental wellness of healthcare workers. I also have a responsibility to take care of my own wellness. I hope everything is fine. I'm seeing someone raised their hand.
Yes, Doctor, you're audible on my end and the slides are moving, but Esther Nana has raised her hand. Esther Nana?
Is
Esther Nana? It's okay. You can continue, Dr.
okay, okay. I was worried for a moment that the slides were not moving. Okay. So what can I do? What can Joanne do, the moderator today? What can Florence do to promote her own mental wellness? So there are many different things that we can do on a daily basis. Promoting mental wellness is not a one-off thing that is done in December when you go for holiday to Mombasa, or occasionally when you're on your annual leave. It's something that has to be incorporated in your day, throughout the week, every single day, every day of the month, to make sure that you're mentally well. So you have to find time to rest. Okay. You could do things that you enjoy every day. You make sure you incorporate one thing that you enjoy, and it's different things for different people. So we can't be really prescriptive about it, but it's for everyone knows what they do that makes them experience positive emotions and feelings of satisfaction and enjoyment, of course, outside of alcohol. But so it can be things like some people like to milk their cow or water their plants or call a friend or call their child. It's as simple as that. It doesn't need a huge budget worth billions, but it really promotes your mental wellness. For some people, it's practicing gratitude. It's waking up in the morning and saying, I'm grateful I can breathe. And then in the evening also saying, I'm grateful. I've been able to make it through the day. So very simple things, but what happens at your neurotransmitter levels is very huge. Exercise as well, having friends that you can connect with, and family. Setting realistic goals is very important, especially for doctors and even healthcare workers. I see this in the course of my EAP work at MTRH, that some of the goals that are set are not realistic and they reflect the goals of another person or of another colleague rather than your own personal goals that reflect your own personal resources. Okay. So it looks really simple, but then it gets people into a lot of challenges and a lot of stress, because everyone is married by a certain age. I should also be married. It mustn't be like that. Or people have done their PhD and I haven't done. People have done a fellowship and I haven't done. But then your circumstances and resources are very, very different. So this I see especially with healthcare workers and doctors, and also knowing your skills and strengths. Don't engage in things that can cause um, a lot of distress. Engage in things that align with your skills and strengths. It's like asking a monkey to swim with a fish. Of course, the fish will win. And then, or if you ask a monkey, a fish to get into a tree climbing contest, again, they would lose. So a fish is best in the water, and a monkey, does his thing best on the trees. And so that's very important. And we call it self-awareness sometimes. So many times we get into a lot of distress and mental health issues because we try to do things that really don't align with our own values, with our own skills and strengths, with who we are. That disconnects. Also, practicing spirituality. You don't need a huge budget. It can be religion, but it can also be many other things. It can be activities that make you connect with nature. It can be activities that make you feel like you're contributing to your community, like volunteering. So spirituality is very broad. It's not just going to church, and it's really helpful, making sure you're sleeping enough and also avoiding alcohol and drugs. And why this is my favorite part is that I don't need anyone to help me do these things. Maybe a few things like social support need people, but for the most part, this is really up to me. This is really within my control as Florence. These are things that I can do, and we cannot pass the buck of self-care to another person. So we also have to take ownership and responsibility for our own mental wellness. Just the same way you eat a meal, no one can eat the meal for you. You know, my friend can't eat the meal and then I'm the one who is healthy. I have to eat the meal as well. So it's the same thing with self-care. We have to take also personal responsibility for our own mental wellness. Okay. So what else can I do as a healthcare worker? So if I am the med soup in an institution, and there's a psychiatrist there or a counselor, and they say we want to start a mental wellness program, then I should support it. Okay. If I'm in a place where I'm able to influence recruitment for counselors, then I should support it. If I'm in a place where people want to develop a mental health workplace policy, then I should support it. So beyond doing things for myself, I should also facilitate things that are happening within the healthcare facility to promote the wellness of healthcare workers. Also treating colleagues with respect, and we'll look at that a little bit more later. That I can do as well, making sure that I'm not, causing harm to my colleague, and of course, not discriminating colleagues who have mental health issues, making sure that we are supporting them too, and making sure they're accessing care. Like sometimes I see on the Facebook group for doctors, someone calls out for help and people are quick to support. And then now, what can institutions do? The model that has been there for over 100 years now is the Employee Assistance Program. And when they started almost 100 years ago, the idea was to deal with alcohol and drug abuse because it had become a really, really big issue at that time in the workplace. But over time, these programs have evolved to incorporate overall staff mental wellness, and in fact, even overall wellness with things like exercise included. And this is the same also for Moi Teaching and Referral Hospital. It started in 2011 as an alcohol and drug abuse committee, and then over time it evolved to include a lot of these other interventions that support mental wellness. So why you should have an EAP program is to support staff mental wellness, make sure also staff are productive, and prevent occurrence of safety incidents. And EAPs, their roles are really two: supporting the staff, but also protecting the interests of the institution. Those two things should always go hand in hand. I'll be lying if I say the healthcare worker is at the top, their interest, and the institution's interests are below. They are equal. The institution needs to make sure that it's meeting its mandate, that is its interest. But also on the other hand, the EAP makes sure that the staff are also individually well, not just for the sake of the institution, but also just for their own personal health. So the MOH fortunately developed guidelines on workplace mental wellness. I think these were launched about a year ago, and they're available online, and people can refer to them to see some of the steps that you need to take to put in place a workplace program for mental wellness. And different kinds of interventions can be implemented, even if you won't call your program EAP or whatever you'll call it, mental wellness program. But there are different, very simple interventions that can be done. So today I want us to live here knowing that there's no huge intervention or very big machine like these ones that we have for radiotherapy and treatment for all these other conditions or dialysis. It's not that way. It's in the small, simple things that can be done by regular staff that we have available in the healthcare setting, the nurses, the clinical officers, and they should be able to implement these interventions. And you may or may not have a psychiatrist, but at some level, you should be able to implement some of these interventions. So one is like regular education to staff to raise awareness on mental health issues. The way I had said earlier, mental health is a very young specialty, it's not yet quite understood. There are a lot of beliefs about it, spiritual beliefs and other cultural beliefs about it. So it's very good to dispel some of the myths about alcohol and drug abuse and mental health conditions to promote destigmatization. Okay. And that is really simple and can be done by um, most healthcare workers. And then another important one is education on how to cope better with stress and how to promote our mental wellness. And I had shared earlier when I started this discussion on interventions, I talked about what I can do myself to promote my own mental wellness. So all those strategies I listed, they can be shared with staff because sometimes people don't know what to do to be well. As a healthcare worker, inevitably you will encounter stress in the course of your work. That cannot be taken away. It's 100% guarantee that in the course of your life as a doctor or healthcare worker, you will experience stress. In fact, I would say in the course of the day, because that's the nature of our work. We see a lot of pain. Our work is to alleviate suffering. So inevitably we experience stress. So many times healthcare workers don't quite understand how to de-stress at the end of the day, how to wind down, how to rest, re-energize, and then pick up again. Also strategies for promoting resilience because it's a high stress job. How do I make myself better able to handle some of those stressful situations? So it's like the way you go to the gym to work out to build your muscle. Resilience is about building your mental muscle just so that you're better able to absorb some of those stresses. And then counseling, if you're in a facility where there's a counselor or you're able to outsource counseling services for staff, then that can be done for individuals, families, in groups, but some kind of counseling. Basic counseling can be done even by some nurses, social workers, or even doctors can do simple counseling. Yeah, of course, where now it's a diagnosable mental health condition, then you would need a little bit more specialized psychiatric care. Of course, in certain institutions, they are fortunate enough to have those specialist services within them. But that shouldn't be a reason for the facilities without not to support. And I've seen as MTRH, we have worked very closely with a lot of institutions and they're able to refer their patients to us, especially for alcohol and drug abuse issues. So when we list their psychiatric care, it mustn't be that you're offering it as an institution, but you're able to link your staff with mental health issues to where they can get those services. Of course, urine and breath testing for alcohol and drugs, especially in the healthcare setting, just because being intoxicated can cause very significant safety issues. And then also EAPs can do other support interventions like helping with redeploying staff. Sometimes staff come and say, I'm not comfortable in this department. The work I'm doing doesn't align with my strengths and it's bringing a lot of distress. So these are some of the things that you can um, work around with management and support staff. Sometimes they need support with managing finances and then also peer support, people who've recovered and support those who are currently struggling with mental health issues. So these were just some interventions that can be implemented. And as you can see, they are not necessarily impossible or very difficult things, or they need a 2 billion budget to implement. With the little resources that we have, we should be able to run some of these programs. Okay. And to make it operational, you will need a committee that provides oversight and sort of coordinates those activities. A policy, it doesn't have to be very elaborate, or you can really borrow from ILO that has a global policy, and then you have a guide for your activities and a budget can be allocated to it or not. But I would say mostly you would need a committee for oversight and then a policy that really guides how activities are run within the institution, how mental health issues are addressed, how alcohol and drug abuse issues are addressed, and mostly because often there's a link between, especially substance use, between substance use and disciplinary issues. But even with mental health, we see a close link between mental health conditions and disciplinary issues. So you have to know how those two things are separated, or if they have to happen together, how they are happening together. So that's where the policy comes in to guide your institution on how to handle some of those challenging issues. So I'm going to talk about bullying, given the recent incident of a young colleague passing on, and then the discussions that arose from that incident. But I'm not saying that bullying was directly the cause, but I feel like that incident allowed us to talk about something that's not talked about a lot, but yet is happening, especially among doctors. So bullying is about being aggressive, okay, and being intentional about it, and that you want to cause harm or discomfort. You're intentional about wanting to harm, to injure, or to make another person uncomfortable. And it can be words, it can even be physical, it can be lack of words, like ignoring, okay? And often there's a difference in power. So the person bullying is at a higher level, kwa hiyo hierarchy. The other person is lower. So it's a boss and a junior. It's an older person and a younger person, Usually there's that power imbalance, and it affects the person who is being bullied. It's quite harmful psychologically, and often they're not able to defend themselves because of that power imbalance. So this is a definition by American Psychological Association. There are a lot of definitions out there, and you can look at them, but this one makes sense. So how common is bullying in the medical setting? So I was surprised to see that, this was a meta-analysis that was done not too long ago. It's a very recent studies. So they combined data from 13 studies you can see from across the world except Africa. And they found that medical residents who are like registrars, 51% of them, perceived that they had been bullied by their seniors. And then this one is closer home and more recent. And this one is for, this is medical students. This is undergraduate medical students. 82% reported that they had been bullied, undermined, or harassed, and that the perpetrators were mainly senior medical staff. That is specialist doctors, consultants like Florence, medical officers, followed by nurses. Okay. I did not find any study that talks about this in Kenya, meaning that we need to also examine and see what's happening here. But Ghana, being in sub-Saharan Africa, is closer home, and these findings may really be similar to what they found in Ghana. So this were the results from the Ghana study, and you can see the most common form of bullying was verbal, okay, or threats. And sometimes the challenge with verbal things, especially if there's no witness, then it's very difficult to report. So verbal was most common, and then sexual harassment, physical assaults, much less, and then also financial, and then others. So this is how the medical students in Ghana felt intimidated or bullied. And then when they were asked whether they had complained to anyone, most of them said no. So it means they kept it inside. And when they were asked why, they said it seemed normal. So I endured. Okay. And this makes me not very excited that, it has become a culture and it is normal. Of course, this is from Ghana, but I have every reason to suspect that, this could be the situation, but we can do more studies here in our setting and see. But this is really sad that the younger doctors are intimidated and then that they perceive that it's normal. Okay. So it seems to me that it's a culture, maybe. It's something that has been done over the years, but fortunately we can try to change things. Um, and just to separate these two things, because also this discussion came up, there's a role for discipline in institutions, in societies. Societies must have order, and similarly, institutions must have order. In a healthcare facility, there has to be order, and things have to be done a certain way. And there are rules and regulations for how those things should be done. So also for the junior colleagues, the expectation that you cannot be disciplined is not a realistic one. If things are not happening the way they should be done, then that should be applied. And really that applies across the board too. Every healthcare worker, every citizen, even we have a lot of statutes that guide how we conduct business in the country. So without a doubt, there's a role for discipline. But discipline is not bullying. Discipline is about you've done behavior X, you're expected to do Y. We are going to teach you how to do Y, or we are going to institute some sanctions, even as we teach you to do Y. So it's very focused on a target behavior, and the goal is to correct it so that things can be done better next time. There's no role of demeaning in disciplining. And discipline is very clear. It's guided by a code of conduct, a HR policy. We even have those within the public service. If you don't have an institution one, it's very clear how things are done when the aim is to correct the behavior. But bullying is different. Bullying is about, I've had people talk about their physical appearance being described, or sometimes even their tribe, or feeling belittled, those kinds of things. And it doesn't focus on solving the solution. So if say a junior colleague comes late for the ward round, then the issue is how they came late rather than their physical appearance. You see, so for me, that's how I would differentiate, and so that the seniors don't feel like, or management doesn't feel like they cannot discipline. Discipline must be there, but then it has a different goal. Discipline is to correct, but bullying is to demean and intimidate. So there's that difference. Okay. So just to encourage that we continuously speak out against a culture of bullying in the healthcare space, because of how harmful it can be to healthcare workers. It can be that we are the ones supposed to be caring for others, and then we are the ones also destroying, each other. So really to encourage that we speak out boldly against bullying, and we encourage a culture that seeks to mentor and to grow our juniors, and even amongst the senior colleagues as well. Sometimes there's bullying and intimidating. I think it's really it's bad to people's mental health overall. So we can have mechanisms for anonymous reporting, investigations, and action taken for people who perpetrate bullying, but also just continuous sensitizations on how we can discourage that culture of bullying and encourage a culture of mentorship and nurturing instead. Okay. And this for me is really, the expectation of an older colleague towards a younger one, that they're supposed to help them to grow and to learn rather than to cut off at the root so that they die, because that is what happens when you describe someone's physical appearance in a word round, while the goal should be actually to teach and to mentor and to help them to to learn, and hopefully we can have a culture that, is different than what has happened before. So really to sum it up is that mental health problems are common among healthcare workers. We are not exempt. What's happening outside there in the community is also what we are seeing among healthcare workers. But there are things that we can do to make sure that these mental health challenges are addressed. And most importantly, that everyone has a role to play in making sure that we have a workplace that supports the mental wellness of healthcare workers. So those are a few references. If you want to look at the Ghana one, I may have forgotten to put it there. Yeah, so that is my email. If you have any questions or any concerns, you're free to email me. And thank you very much for listening today. I will hand it back to Dr. Joanne to take us through the next session. Thank you.
Wow, thank you so much. Thank you so much, Dr. Jaguga, for that very, very, very inspiring as well as insightful conversation. My mind is still rolling around the statistics. Shall you all just take a minute and appreciate Dr. just through our reaction, kindly? Just take a minute and appreciate Dr. Thank you so much for the conversation that you've given to us. Thank you so, so much for the honesty, even around one particular area which has come up recently through the conversation we've been seeing across the social media handles. I believe it actually is time for us to have this insightful conversation. One of the things that's really hit me hard when you were talking, Dr. was when you talked about how we always feel the pressure to get to a higher level as doctors. So we set for ourselves goals which are not applicable to ourselves but to other people. And for me, that has really hit home, especially as a young medic who has completed her internship. And there's a lot of pressure for people to start settling into new places and all these changes which are happening in life. Thank you so much for that. Allow me just to read some of the conversations, or rather, some of the comments that people have been having for us in the chat box just before we go to the questions. A lot of love for you, Dr. A lot of hand claps coming in through reactions on the chat box. I hope you're seeing all of the love through hand claps. Oh, and with very, very beautiful flowers too. Now, I had seen a couple of us who had posted some comments in the chat box. Allow me to read them. Agnes Mwangi, she said this. Another strategy can be encouraging healthcare workers to do a course in counseling psychology or clinical psychology by giving incentives to the ones doing the course by promoting them. By doing the course, one counsels self can counsel also a neighbor and a colleague. This also increases the availability of these care services. Thank you so much, Agnes Mongi, for your comment. Peter Nyabuti says, when it comes to treating colleagues with respect, it has to be horizontal and vertical. Some of us assume that someone working under us can be given any instruction at any time without due consideration of his or her state. I have also noted different cadres treat other cadres differently. Thank you so much for that very, very thought-provoking and honest comment, Mr. Patrick. We also have a comment from Esther. She says, I think regular meetings of staff and management should be encouraged to bridge the gap between managers and workers, where the staff can be able to air their views without being victimized. I really, really do love that particular comment. Next, we have a comment from Robert Bett, where he says, sanction bullies in the workplace. I was triggered by the letters that were written without due consideration on what KMA, KMPDC, and KPDU mandates are deliberately designing emotionally intelligent systems in place. Thank you so much, Mr. Robert, Dr. Robert, sorry. Yes, we had a comment from Joseph Kimondu, who was asking, will it be possible to share the recording of this important talk? Yes, it's going to be on the KMA YouTube channel. Do follow up on the YouTube channel where you're also going to get a chance to view other important webinars which have been done under Kenya Medical Association. Thank you so much. Thank you so much. A lot of love coming from the section. Joyce says, nice, more work from the holistic perspective. Engage medical and clinical psychologists. Thank you for that comment. Mary says, Mary Njuguna, I encourage hospital managers to reduce stigma for mental health as well as stigma to mental health workers. Most times we need the mental health workers to take care of other staff having mental issues. Therefore, the mental health of the mental health workers is very important. Amen to that. Now, do we have questions? I see a couple of hands which are raised. This is by Leah B as well as Titus Ocharo. Leah B, you can unmute your mic and be able to ask a question. Leah B. Afterwards, we will have Titus Ocharo. For those of us who might be having questions that we would wish to ask our very beautiful and able presenter, Dr. Jaguga, let's kindly type them in the chat box. For those of us who wish to ask verbally, we can also raise our hands. I'd like to give this opportunity to Leah B to ask her question kindly. Leah? Okay. Ibrahim said, good presentation. Bullying in the healthcare system is real. I definitely do agree on that. Holistic approach in handling cases is important. Very, very important. Titus Ocharo. Titus Ocharo. Titus has raised his hand. Okay, I have read your comment, Leah. No question from you. Titus, do you have a question from you? Okay. Let's move on swiftly in the interest of time. Magdalene Kogo, you have raised your hand. Do you have a question kindly? The floor is yours to ask. Those of us who have questions, we can type them in the chat box. Ami Ekim says, I did a study on the prevalence of burnout among medical residents in Kenya, and the rates were high. Wow. Thank you so much for doing a study on our soil. Would really, really love to be able to get to know what it is that you found out. Isaac Kiplimo says, the line between discipline and bullying is very important. The risk of senior colleagues to be indifferent to younger colleagues can also occur, hampering development and transfer of skills as they fear to be branded as bullying. Wow, that is very deep. Luciana, do we have any question from Luciana? A very deep statement from Wesley and daughter. Broken people break people. Very thought-provoking. Milka Obwenyi says, most medical settings focus on physical treatment and ignore the role of psychological intervention among the patients. What can be done in healthcare settings to increase the psychological care of both staff and patients? Dr. Jaguga, allow me to repeat that question, then you can respond to it. Most medical settings focus on the physical treatment and ignore the role of psychological intervention among the patient. What can be done in healthcare settings to increase the psychological care of both staff and patients? Do respond, Dr. Jaguga. The floor is yours.
Yeah, thank you for that question. I had alluded to it earlier that it's taking a bit of time for mental health to be accepted within the medical setting. But if you look at the definition of health for WHO, it includes mental health. One, and then a lot of studies in the recent, decade or so, especially in Kenya, have shown the burden of mental health conditions. So now we know it is definitely there. And then it's going to take a bit more time for us to employ psychological counselors, accept them into our health institutions, make sure that we are prioritizing a psychological counselor as much as we are doing for a radiology machine and so on and so forth. So it's a journey and it needs continuous advocacy. I cannot lie that there is this one perfect solution that we are going to do now and then boom, tomorrow we are having mental health care. But it's just continuous advocacy and accepting that mental health is as important, as physical health, you know. Yeah, that is what I would say, just continuous advocacy. And even through webinars like this ones, we are seeing how important it is even for us healthcare workers to pay attention to our mental health and how it can have very negative consequences if we don't pay attention to it. So let us just be continuous advocates.
Wow, continuous advocacy. And also one other thing I've heard from you, Daktari, is where you're saying we have to be intentional about cultivating this positive culture in the workplace. It doesn't just happen by default. It is through intentional conversation. It is through care and concern. It is through emotional intelligence about the kind of power that our words carry and the impact that they carry towards each other. Allow me go back to the comment section. A lot of appreciation for the presentation. Some people not having any questions, they do feel the presentation is very thorough. Lida Musili asked this question. What one piece of advice would you give someone who has developed depression and substance abuse due to toxic workplace and is being bullied by supervisors? No clear HR reporting avenues and no EPA at the workplace. Let me read the question again. What would you give someone who has developed depression and substance abuse due to toxic workplace and is being bullied by supervisors? No clear HR reporting avenues, no EPA at the workplace. Dr. Jaguga, kindly respond.
So the KMA Physician Wellness Committee is in place, and we are ready to support with some of these issues that people may face, and I understand you cannot disclose a lot of your details here, but I shared my email at the end. I can share it again. You can email me and then we can take it up from there, how we can support you and also see how we can support that institution.
Thank you, Dr. Very elaborative presentation. This is from Titus Ocharo, just appreciating the work that you've done. Joseph Kimondiu reiterates once again, bullying must be curtailed since those bullied will often become bullies in return. But I hope from today's conversation, for Dr. Joseph and to all of us, I hope that from today's
Yeah,
conversation,
absolutely.
we are
Sorry,
able
Joanne.
to stop. Yes, I'm just saying
Joanne,
that
can
from
I make
today's
a comment?
conversation, yes, Daktari, it's okay.
Okay, sorry to cut you short.
It's okay, Daktari.
You see, I will not know any other way of handling challenges in the workplace other than through bullying, if that's what I observed from my senior, Monkey see, monkey do. So it's the same thing. So we have to break that cycle by, with this generation being the ones that do it differently and mentor more and discipline when needed, so that now the younger ones can learn the same thing. Otherwise, if I bully, then those who are watching me will bully and that chain continues. So what Joseph is saying is absolutely true.
Thank you so much, Daktari. And I was just saying, I hope that we become the cycle breakers, that the generations of medical students, medical interns, younger doctors who are going to come after us will appreciate a healthy environment because we have been intentional about getting the right conversations and doing things right to set the path forward. Just to continue looking at the comments as well as the questions here. Patrick is asking, how can I as a junior officer handle a situation where my senior always reports late, leaves early to go to a point that I do not have a day off. How best can I handle this? I'll repeat. But Patrick Nyabuti is asking, how can I, as a junior officer, handle a situation where my senior always reports late, leaves early to a point that I don't have an off day? How best can I handle this?
Yeah, and a lot of challenges like these ones and similar ones will continuously see in the workplace where there's an interaction between a senior colleague and a junior colleague, and a junior colleague doesn't feel the circumstances of work are fair, and it's tough for them to report. And I think we need anonymous mechanisms for reporting. Because I'm wondering how Patrick is able to walk up to the med sup or the CEO and say that senior X is not handling their duties well. That would be really challenging to have that conversation. I can see how that would be hard. So we need to put in place ways in which we can anonymously report some of these challenges, and then hospital management can take it up from there. It would be hard also as a junior colleague to confront a senior colleague. I also agree, especially given the hierarchies in the medical setting. Yeah, but you definitely, Patrick, this was Patrick. Yeah, Patrick, you definitely need to share this with another trusted colleague in the absence of that anonymous reporting. Maybe share it with another more senior colleague that you trust in your own institution, whether it's a doctor or someone in another department, and they can guide you on how that can be handled rather than directly confronting.
Thank you so much for your response, Daktari. Magdalene?
Hello, guys. Thank you for this opportunity to make my contribution. Thank you, Dr. Joan, for moderating, and also Dr. Kimboy Florence for this wonderful presentation. It's very timely. We needed to have this conversation like yesterday. So mine is just like not like a comment and not really a question. And what I have noticed in my few years of experience is that doctors are working with past traumas, and they're transmitting it to their juniors in various ways without even knowing that. And I feel like our training might be contributory. We might need to change a lot of things. Policies have been put in place. Just last year, we launched the first workplace policy, mental health workplace policy, in around October, around this time, actually, almost a year anniversary. And I don't think many workplaces have actually implemented some of these things. I can ask people to like even go through the HR manuals and everything and try and see if there is even a mental health committee that can specify whatever protocols or policies that to be followed within the workplace when people are experiencing mental health challenges. And these things stem even from the management down. When you find even your seniors are the ones who don't even know how to handle some of these things. Emotional intelligence is really one thing for many doctors, not even in senior positions, even amongst ourselves as the way we deal with each other and amongst other cadres. And I feel like before someone is given a managerial role, they need to go through this training for emotional intelligence, other than the IQs that we are told that people have high IQs. And you also need to realize that it's not like like you're managing people, and that you need to put yourself in their shoes in the event something like that happens to you. So most people, what I see they do is they just trickle down whatever the management is telling them to their juniors without thinking as individuals how they would diffuse a situation or how they can handle a situation. So it's just a challenge to all of us, even as we rise through the ranks, that we should remember where we came from. We should treat others the way we would want them to treat us, and we should try and agitate for mental health policies to be put in place and structured so that we can be able to follow written protocols to be able to handle some of these things. But as Dr. Jaguga has mentioned, it's going to take some time. Eventually, we are going to get there, but this is just the beginning, and let's continue doing this. Thank you, Physician Wellbeing Committee, KMA, for organizing this. I'm looking forward to the rest of the CMEs that we are having for this quarter of the year. Have a good evening, people.
A lovely evening to you too. Thank you so much for your comment, Dr. A lot going on our comment section. Beth Akinyi says, the problem with civil servants is that senior SWAT is final. I think our employers need to be trained to do thorough investigation and not listen to junior officers. Ernest Ondiage says, senior medical colleagues should know the difference between being respected and feared. Let us stop bullying among healthcare workers. Daniel Lane says, besides seeking counseling services, you mentioned about building resilience and emotional intelligence. He has a question rather. How do you do that? And what extent can these skills be of help? Let me read that again. Besides seeking counseling services, you mentioned about building resilience and emotional intelligence. How do you do that? And to what extent can these skills be of help? Dr.
Very good question and very, very important. Definitely extremely useful. You know, if you look at the stress, distress, depression continuum, when you're stressed long enough, you're not addressing it, or over multiple stressors come into play, then you move into the distress place. If that's not handled well, then it's easy to slide into depression as well. So switching off this stress response on a daily basis is extremely important, so that the small things that harass or frustrate us in the course of the day are not piling up, and we are not transitioning to psychological distress and then depression. So very useful for resilience building, just how you make sure you eat a healthy a healthy diet, to be a balanced diet to be healthy, and just how you exercise to make sure that your cardiovascular functioning is good. That's the same way you should practice. A lot of these self-care tips and strategies for building resilience. It's like building your immunity. It's the same thing, and it's really useful. Of course, resilience building may not necessarily help to prevent all mental health conditions. You know, I should be clear with that. For example, they may not necessarily prevent schizophrenia and so on and so forth, but they would help to prevent significant psychological distress and even getting into the mild depressive area. And things for building resilience are the ones that I posted for self-care earlier. And that's why when I was posting, I said, let's not look out for a very big thing that we can do one day and then we are resilient. It's in the small, consistent things that we do daily, including a very simple one that I like to practice, of gratitude in the morning and gratitude in the evening. It takes me away from being negative and helps me to focus on the positive, and now I'm ready to handle the day and I'm ready to deal with stresses. So it's in the very small things that we do daily, like physical exercise, avoiding alcohol and drugs, practicing gratitude, spirituality, living within your means, which is not setting an unrealistic goal, and doing things that align with your skills and strengths. So all those things build resilience and prevent the onset of a lot of mental health conditions, including things like burnout and psychological distress. So we may not capture all the range of self-care practices today, but I want you to just Google on the net self-care, and then you read some of those tips that they give for how to build your mental resilience and promote your mental wellness. And those are the things that you need to do daily. Extremely important. None of us eats once a week. We eat 3 times a day, maybe with 2 snacks even. So the same thing, to promote your mental wellness, practice this self-care, acts throughout the day, throughout the week. Okay. Joanne, I don't know how much time we have.
Currently on my clock, it's 14 minutes past 8 p.m. I think we can just have around 8 more minutes of question and answer. After that, I will invite our able convener,
Dr. Lindsay, who will invite our able Secretary General of the Kenya Medical Association.
Okay, fair enough. I'm happy to take more questions.
Thank you so much, Dr. for your kindness. Violet is asking, how can we get this presentation after? We're going to have it uploaded on the Kenya Medical Association YouTube channel. Dr. Silas Ayunga notes, all cadres of health personnel, both senior and junior, suffer from mental illness, but the mental health departments find it extremely difficult to handle colleagues in both county and referral hospitals in the country. Dr. Daido says, kindly, could you address the same question, but in a non-medical work environment that does not have a KMA committee of sort? I'm not too sure about your question. Probably let me read the other comments and questions, and I can be able to give you a chance to ask your question directly. Osimbo says, Osimbo Makuku, that is, the issue of bullying needs to be addressed from an early age so that children grow up understanding what it looks like and is not normalized behavior by the time one enters the workforce. Amazing, amazing. Dr. Benson Gakinya, pleasure to have you here, Dr. We increasingly have a big number of medical workers with mental illness, but not having insights. They are not necessarily denying. If such a person is asked to see a mental health provider, oftentimes they complain of discrimination or even bullying. The senior in this case is accused of bullying. I don't know what you'd advise on this one. Allow me just read this again. It's really bringing an interesting and important perspective. We increasingly have a big number of medical workers with mental illness, but not having insight. They are not necessarily denying. If such a person is asked to see a mental health provider, oftentimes they complain of discrimination or even bullying. The senior in this case is accused of bullying. I don't know what you'd advise on this. Dr. Jaguga, I'm really curious to hear your response to this. The floor is yours.
Thank you so much, Professor Gakinya, for this question. And this is what I was saying earlier. We have to accept that we can face challenges just like everyone else in the society, including mental health challenges. We are not immune to them. And this is what I said about healthcare workers not being able to seek care because they're not accepting that they have mental health conditions. And sometimes, for sure, a staff doesn't have insight, but now their family members who have insight are also not accepting that their relative is unwell or needs support. Okay, until really at the tail end, when not too much can be done, that is when the families accept that, okay, fine, you can take them to rehab, or okay, fine, let us start mental health medication. So I think the challenge is really one of stigma. And Prof. Gakinya, one of the things that we have at our disposal is involuntary treatment. Those opportunities are there and they are allowed by the law, and it is something that we can use because also the law acknowledges that sometimes people with mental health conditions may not quickly seek care and they may be at risk of, harm themselves. So that is one tool that we use even within the EAP committee to sort of support staff who are reluctant to seek care. And also, Prof, and also colleagues, that you can't prevent someone from complaining. If someone is sent for mental health care and they come complaining that they are being victimized, I will just listen to those complaints and then do my own, objective assessment and tell them, fine, you're saying they're victimizing you, but also from my own assessment as a psychiatrist, I can see that there's a manic episode or you have severe alcohol use disorder. So I think it's also part of that denial of people not wanting to accept that niko na shida ya pombe or I am severely depressed. Yeah.
Thank you, Daktari. We have 1 more minute or 2 more minutes for questions. I'd like to humbly request that you do understand us. It is a very intriguing and deep conversation, but not to worry, this is a conversation which will be happening each and every week on Tuesday from 7 to 8:30 p.m. Dr. Mwangi Masharia asks, how can we deal with the opportunistic Doctors who escape duties at the expense of others. How can you deal with opportunistic, tough word for me, doctors who escape duties at the expense of others? How do we differentiate the lazy doctor from the stressed one?
Very good examples of challenges that we face in the workplace. Again, for me, it's that doctors in health facilities and healthcare workers should have a forum for sharing some of these challenges, you know. What are the channels for reporting? Is there a head of department? Is there HR manager? Is there a med sup? Is there a CEO? What are the channels for reporting some of the challenges that we face? Because this happens a lot. It's actually happening out in the counties that some doctors are not showing up on duties, and then there are others who are stationed there working, while the one who is away locally is drawing a salary. So, there has to be mechanisms for channeling some of these complaints and also dealing with some of these opportunistic colleagues who are not fulfilling their mandates. There also has to be a consequence for going to the ATM every month on the 30th and not offering services. So I don't know whether now you as a colleague to this doctor should be able to address it. I feel like it is above you as a colleague unless you're in a managerial position. And if you're, a HR manager or up as a CEO, then you invoke some of those, HR clauses. So people, need to be consequences for people not working. How do we differentiate the lazy doctor from the stressed one? A mental health assessment would help us to know whether someone is depressed, or or otherwise. So they would need to be assessed by a psychologist or a psychiatrist.
Thank you so much, Daktari, for all of the insights that you've shared and also for responding to all of the questions which have been asked. I'd like to just have you give us your parting shot, probably 30 seconds.
For me, as always, it is everyone's business. We all have a responsibility to play in making sure that we are well, first of all, ourselves, in making sure that the institutions, the departments that we work in are well, and then now we can extend our services out into the community. So we all have a role to play as doctors in making sure that, there's a culture of of supporting mental wellness in the different health facilities we work in. Thank you.
Thank you so much, Daktari. And thank you to every single person who's joined this conversation, engaged in the chat box, and asked questions. We do hope that the information that you've gained is going to give you power to be able to act effectively in cultivating and curating positive cultures of transformation in your workplace. I have been your moderator, Dr. Joanne Kailiti, and at this point, I would like to invite our very able convener and very beautiful too, Dr. Lindsay, to take over, after which she's going to be inviting our very able Secretary General, Dr. Marion, who is also going to come and give her comments. Asanteni sana, wishing you a blessed night. Dr. Lindsay, the floor is yours.
Thank you very much, Dr. Joanne Kailiti. That was an excellent moderation. Thank you, Dr. Florence Jaguga, for the very well put presentation on curating a culture of mental health at the workplace. So this year's World Mental Health theme is actually, it is time to prioritize mental health in the workspace. And so we as a Kenya Medical Association Physician Wellbeing Committee are taking that theme and running with it. And as earlier alluded by the moderator, Dr. Joanne, we shall be having weekly mental health webinars every Tuesday from 7 p.m. to around 8:30 p.m. to address certain mental health challenges that are affecting us, most especially at the workplace. And why mental health is important in the workplace, it's because it really is a growing concern. And for far too long, we have viewed workplaces purely as places of either productivity, performance, places to flex how good we are in surgery, how amazing we can be as physicians, and also a place for profit. And in all this, we have actually left behind and put behind mental health challenges. So according to the World Health Association, WHO, depression and anxiety alone is actually on a rising global economy. And it is even more alarming because it is taking a toll on the lives of individuals, as we just saw 2 or 3 weeks ago when we lost our dearest Dr. Desiree Mora Obogi. So we must then take this opportunity to break the silence. Mental health is not a weakness. It is something that needs to be shouted upon the rooftops, celebrated, and prioritized. Our workplaces from today henceforth need to be spaces where mental health is valued just as much as physical health. Even like how you would see a fellow doctor or a healthcare worker with a broken leg walking with a walking aid, and you'd be so quick to ask, hey, Daktari, what happened to your leg? In the same measure. That is how we need to start advocating for and even curating a mental health culture where we try to get to see where there's burnout and address it very early, be able to destigmatize mental health challenges amongst healthcare workers, and offer necessary support. We should be able to prioritize mental health in our workplaces, in our hospitals, in our clinics, and we need to be able to cultivate a culture of support and understanding. And this actually starts with the top leadership trickling down to the lowermost person in office. This includes medical superintendents, managers, CEOs, executives, and supervisors, including consultants in the various departments, to be able to willingly have open conversations about mental health. We also strive to encourage us all to be able to focus on prevention of burnout, have better stress management skills. We will be able to try promote work-life integration because we are aware that work-life balance is actually very elusive, and be also able to create opportunities for mindfulness in the workplace, which is actually not a luxury, but a demand that we are placing in all workplaces in the healthcare spaces. Finally, I want to call all of us to action to be able to advocate for better mental health policies, encourage your colleagues, other mental health workers, to be able to seek mental health care where you see that a worker may need such kind of help, and be able to, most importantly, take care of your own mental health. Self-care is not selfish. A doctor who does not take care of themselves can really not be able to take care of others. And with this, I will be able to now bring in the Secretary General, Dr. Diana Marion, to bring this meeting to a close. So I hope to see you again next week, every Tuesday, 7 p.m. to 8:30 p.m. It has been me, Dr. Lindsay, the Kenya Medical Association Physician Wellbeing Committee. Over to you, Dr. Diana Marion.
Thank you, Ida. It has been a very fulfilling evening. And what I want to say is when we face challenges and we identify these challenges and we come forth and have discussions amongst ourselves on how we can actually raise solutions and help each other. It's very important. I really want to appreciate Joanne Kaliti, our young doctor who has been the moderator for this session. She's done a fantastic job. I want to really appreciate Ida and her team. And this team is the Physician Wellness Committee. They are doing a good job, not just through the webinars, but also behind the curtains. You can really reach out to KMA. So if you feel maybe at your workplace you don't have someone to talk to, or you feel that space is not very safe for you, reach out. As a doctor community in this country, we are a family. So there's no limitation on how far you can reach out. Reach out so that we can actually sit together, reason, and see how we can help. Do not handle anything that you know very well you should not be handling alone. One of the things I like to say is that there's a reason why God did not just create you alone. You were born in a family, you live in a community, and there's a very good reason why that is the way it is. So reach out. Don't feel limited to reach out, because when you reach out, then you're making people around you to be aware. Number two, let us not be the reason why other people are having issues with their mental health. Try as much as possible to create the environment for others as pleasant as you would want it for yourself. So whether you're senior or you're junior or you're in whatever level, whether you have witch power or you don't have witch power, kindly, every single time, any word that comes out of your mouth, any action that you put out there, let it be something that is not going to burn someone else. Think about it very carefully. And one of the things I would say is that you really will not enjoy making someone else's life miserable. So let us strive to make an environment that is pleasant for everyone around us. And finally, our presenter, the beautiful Dr. Florence Jaguga, you have been very supportive, not just now. You have been with us throughout the COVID period when we had a lot of issues also around mental health for our healthcare workers, not just the doctors. And you've been here and you've always asked that anyone can reach out to you and your team and you can help. So I want to tell the audience, thank you for attending. And what I want to reassure you is that you can always reach out. Your engagement through your questions and through your comment has been very good. What I just want to say, let's commit to fostering healthier work environments. And let's remember to prioritize our mental well-being. It's actually your individual responsibility. So if you are able to do that, then collectively we are creating not a better present day for us, but also a future. Remember, someone actually mentioned we should train our children from an early age. And I can assure you, if you start it now with yourself and with the community around you, it will just flow to the generations to come. So let me thank everyone and wish everyone a very good night and continue joining us. Please join us in these webinars and join us in all the activities you see us putting out there from KMA. Let us be one big family. I'm sure we have a way we will come through for each other. Thank you.
Thank you very much, Dr. Diana Marion. And with that, I would like to bring this meeting to a close. Feel free to follow us on Facebook, the Kenya Medical Association, X-Space at KenyaMedics_KMA, Instagram at Kenya_Medics. Let us have this conversation going on the X-Space. Have your comments put down on Facebook, Kenya Medical Association. Have these comments put on IG at Kenya_Medics. Thank you very much, everybody. We were able to record 339 participants. This is a very big record, and we hope to have you this and every Tuesday, 7 p.m. to 8:30 p.m. From all of us at Kenya Medical Association Physician Wellbeing Committee, we say a big thank you and have an amazing night. Goodbye, everybody. Feel free to log off and have an amazing rest of the week. Happy new month of October, everybody. Later.